Hello and welcome to Seven Sentinels. This is Grand Master Class and I'm Peter Simon with you. Today we have Neena, Johny with us and we are doing this role play, insulin injections. Yes. Neena, Johny, once you're ready, you can start.
Yes, sir. How may I address you during role play?
You can call me Lincoln because Mr. Lincoln, because my name is Abraham Lincoln and I'm 60 years old.
Okay. So can I start, sir?
Yes, of course.
Good morning.
Good morning, nurse.
My name is Neena, one of the registered nurses who is working this medical clinic. You are Mr. Lincoln, right?
Yes, of course. You're absolutely right, nurse.
Okay, thank you. Okay, Mr. Lincoln, from your case note, I can understand that you have a type 2 diabetes and recently your blood pressure has been elevated. So your doctor advised to take insulin injections and you are here to get some advices regarding how to administer the injections by yourself. Am I correct?
You're absolutely right, nurse.
So, Mr. Lincoln, so could you please tell me how you feel about the insulin injection?
Yes, nurse. I'm a bit anxious and I'm unsure about starting insulin injections because I have been managing my diabetes well until now. So why do I need these injections?
Okay, from your face, I can understand that you are quite worried and anxious. So, are you scared to the injection process or pain and needles?
I don't just really like the thought of injecting myself. How is that possible? I'm not a nurse or any expert. I don't think I'll be able to do it, nurse.
Okay, Mr. Lincoln, I really understand your concern and I know that you are quite anxious regarding the injection process. So let me tell you how to manage this anxious regarding the injection process. So I'll provide you detailed and clear instructions regarding self-administration of injections. Once you follow these instructions, you may feel very easier after the regular practice. How does that sound?
Yeah, that's a fine, nurse. But in the first place, why do I need to take these injections first of all?
Yeah, let me tell you about that. Before that, insulin injections will provide you a lot of benefits because once you inject the insulin, it will quickly absorb to the bloodstream and it does not break down in the stomach, as well as it is very profoundly beneficial than your current medications. And you asked why the insulin injection is necessary for you. So let me provide you detailed information regarding that. In earlier, you manage your diabetes with a diet and oral medications, but currently it does not effective and properly work on you. So that's why your doctor advised you to take insulin injections to manage your blood sugar level normal. Is that clear now?
Yeah, of course, nurse.
Okay. Additionally, you have to follow some preliminary precautions before you taking the injection. First of all, you need to wash your hands and dry it properly. Then you need to pinch the skin where you want to take the insulin injections. After pinching the skin, you can insert the needle into the skin very slowly in a 45 to 90 degree angle. After completing the after completing the insulin injections, you can leave to the place the needle 5 to 10 seconds. Is that clear now?
Yeah, of course, nurse. But I am a little bit tensed about what you're telling, all these things, because I want to know if there is any chance. Is there any other way to manage my diabetes other than these insulin injections?
Yeah, I can tell you the detailed informations regarding that. In earlier, I already mentioned that in earlier, you managed your diabetes with a diet and oral medications, but currently your blood sugar have been high. It means it's elevated. So that's why your doctor advised you to take insulin injections in order to manage your blood sugar level normal. Now it's clear to you?
Yes, of course, nurse. I understand. All that information is clear. Now you can explain me the procedure.
Yeah, let me explain to you the detailed informations regarding the insulin injection procedure. First of all, before you taking the insulin injections, you need to wash your hands and dry it well. Then you need to fill the insulin needle as the required amount. After that, you need to pinch the skin where do you want to inject, then insert the needle very slowly to keep a 45 to 90-degree angle. After injecting the insulin, you need to keep the needle for 5 to 10 seconds to complete the insulin injections. Is it clear now?
Yeah, of course, nurse.
Okay, once you complete the administration of injections, you need to rotate the injection site very gently in order to prevent the development of lumps, as well as it also help to mitigate the risk of poor insulin absorption. I hope it's clear to you. Am I correct, Mr. Lingan?
Yeah, of course, nurse.
Okay, would you like to ask any other questions regarding the insulin?
Yeah, I feel better about the injections now. And
Okay.
okay, that's fine, nurse. I am ready for you to watch me give myself an injection.
Okay. Importantly, I would like to tell you one more information regarding the insulin injections. After you're taking the insulin injections, you need to dispose the waste, which include needles and the syringes properly into the suitable container. Make sure that you have to be care and handling it very carefully. Furthermore, you may have a doubts regarding how to store the insulin very properly. So let me tell you the details about that. You need to keep the unopened insulin into the refrigerator and avoid the exposure of the sunlight and high temperature. Make sure that you need to check the expiration dates of the insulin bottle regularly before you inject the insulin. How does that sound, Mr. Lingan?
Yeah, that's very fine, nurse. That's very fine. And
Okay,
anything else I need to know?
I think I almost clear all of your doubts regarding the insulin injections, and I hope that you understood all of the instructions I discussed with you. So, can I get a consent for observe your self-administration of injections? Are you ready for that?
Yes, nurse. Yes, nurse. I give you my consent. You can go ahead with everything.
Okay, thank you, Mr. Lingan. In case any additional information is deemed extremely relevant, please do not hesitate to contact me. I will clear all of your doubts regarding your current situations and management of diabetes. So thank you, Mr. Lingan. So I will do the necessary arrangement for administrating the injections by yourself. So thank you, Mr. Lingan, for listening this.
Yeah, that's very fine. Thank you very much, nurse. Yes.
Thank you. Thank you.
Okay, now coming to the point, let me give you some feedback. Yeah, right. First of all, let me come with a good note. Overall, your speaking session, I can label it as good. Yeah.
Thank you, sir.
Time consumed is something more than 6 minutes. So you have to limit 6+ minutes, and you have to limit it to 5 minutes. Okay, fine. Next one, you use the phrase as well as, and actually you have repeated a second time.
Yeah.
So first you told as well as, and again you told as well as. You need not repeat one. Okay, not only, but also you can use, in addition, you can use something else, you can use. So same phrase, don't repeat. And both the times you used it wrongly. So you have the audio here, you have the video here, you have the outer script here. I'm going to give you the PDF, everything. So your usage of as well as is wrong. Now there are two steps for this one. You either, if you feel that you cannot learn this, you avoid it. Totally avoid it, because the way how you have used it 2 times, in both the situations, it is wrong. So avoid using as well as in your speaking sessions. Instead of that one, you can use additionally, or in addition to that, or not only but also. So you can use something else, but avoid. Number one option. Number two option is write down some sentences how you are using as well as, and then send them to me, and I'll correct those sentences. Actually, the way how you are using is wrong. That's the thing. He drinks as well as smokes. Okay. Drinking as well as smoking is prohibited. Drinking as well as smoking is prohibited. Or else you can say, smoking in addition to drinking is prohibited. Not only smoking, but also drinking are prohibited. So you have to be very careful what type of style you are using. So better learn before writing. So just to take in two sentences and adding as well as is wrong. That's what I tell you. So you write your sentences and I can correct them and give you. Next one, you said the detailed informations. Information is uncountable noun. You cannot say S, plural. Detailed information. Detail. There is no A, there is no informations. It's neither singular nor plural. It is uncountable, like water. Next, you have used it 4 times. 4 times. Informations. And 4 times you have done mistake. You should never say S with information. I'll give you some information. I'll give you more information. I'll give you much information. Most of the information is right. But you cannot say some informations, many informations, more informations. You cannot say one more informations. That this is wrong. So be careful with this. So if you cannot tell correctly, then avoid it. Or stop using informations in plural. That's it. Information is right. There is no A, there is no informations, just information. Next one. Blood sugar level. Blood sugar have been elevated. Blood sugar have been elevated. Blood sugar has been elevated. Or else blood sugar levels have been elevated. It should be, if you want to use have, you have to use levels. Blood sugar levels have been elevated, or blood sugar has been elevated. Next one. Explain to you. I will explain to you. Why did you say to here? I will explain you. I will give you. I will tell you. I will teach you. Then why this to? There is no need of to here. I will explain to you. If you want to use to, you should say, I will explain the problem to you. So in between you and explain, you should use something else. I will give the solution to you. So if the other one is not there, there is no need to. I will explain you, I will give you, I will tell you, I will question you, I will answer you. That's it. Why are you using to? Simply. The next one. Mr. Lincoln, Mr. Lincoln, Mr. Lincoln. Number of times you're using. Actually, if I am Mr. Lincoln, I'll get irritated. Why are you taking my name so many times? Don't I know that my name? Do you think I forgot my name? I'm the only one person. Already told you my name is Mr. Lincoln. So why are you talking Mr. Lincoln so many times? If there are 3 or 4 people and you are changing the topic and changing the subject, changing the person, then you can say. But otherwise, no need. Next one. One more informations. What do you mean by one more informations? I'll give you more information. I'll give you additional information. I'll give you some information. I'll give you a lot of information. There is no S. And you cannot say one more. It is not countable. How can you say 1, 2, 3, 4? How can you say one more informations? This is a very big blunder you are doing. Then next, you may have A doubts. Why are you using A here? You may have doubts. A, you may have a doubt, or you may have doubts, plural. You may have a doubt, singular. You may have doubts, plural. Use either singular or plural. You're using A and S both. Just a big mistake. Next one, exposure of the sunlight. Exposure of the sunlight. What do you mean by exposure of the sunlight? Exposure to the sunlight. It's not of the sunlight. It's exposure to the sunlight. You're exposing yourself to the sunlight. You're exposing this insulin to the sunlight. Not exposed. Sunlight is not exposing to you. You are exposing yourself to sunlight. Sunlight is always there. Sunlight is always there. You can hide from sunlight, or you can open yourself to sunlight. You can expose to sunlight, or you can hide from sunlight. Sunlight cannot be exposed. You only expose to sunlight. That's what it is. So exposure to sunlight. And you said exposure to the sunlight. The sunlight is not needed. Exposure to sunlight, that's enough. Next one, it's not one and only sunlight, it's that. Next one. So these are some mistakes which you have done. And coming to the point, idea generation is good, no doubt. Your way how you're processing your thoughts, step by step, you're doing well. That's not a problem at all. Next one, quality is good, no doubt regarding that. Confidence level is a high confidence level. It's not very high or extremely high, but it is just a high. The next one, grammar. You're faltering at grammar. Your problems with your grammar. These are the things which I have corrected a number of times, but you're doing the same mistake out of, habit. You need to do some you need to get some dialysis. Your blood should be cleaned of these mistakes. So what you do is recycle these words and try to use them in a good way and repeat them multiple times. That's better. Next one. Yeah, grammar is a problem, a very serious problem you have seen. Next one is vocabulary. Vocabulary, I can say it is average. It's not very excellent. You can use C1, C2 vocabulary. Right. Then pronunciation is fine, no problem with it. You're quite understandable. The message is passed through and I'm able to understand it very clearly without any hindrance or obstacles. Next, repetition. Yeah, that's another problem. You're repeating some phrases and some vocabulary. For example, informations, 4 or 5 times you have used. Avoid that. The next one is fluency. Yeah, fluency is there. Here and there are some bits and pauses, breaks and pauses. And there is some unnecessary sounds like that. Otherwise, you are fine with it. Then presentation. Presentation is good. The way how you're presenting your ideas are good. Variation, you are also changing varieties of sentences you're using. That's also good. But I need to focus more. Right. Then practice more sessions. That is what I can tell you. Practice more sessions. Yes. Now, yes, Neena, Johny. So I have given you the feedback for the sessions. Actually, I would have taken the video like this one and taken, but anyhow, that's okay. Right. Now, I have given you a number of points. I don't know how you agree with me, or you disagree with me, or you totally agree with me, or you partially agree with me. You do not agree at all. You totally disagree. That's your point. That's your wish. But if you really intend to transform your speaking styles, it's better to follow my suggestions, because yeah, every student is a favorite for me unless and until they are, following the system. Once they do not follow, then they'll be missing many things. So what I tell you is follow all the things which I have told you. I've taken pains to try to edit all these things, and I'm going to send you the PDF also. I'm going to give you your voice and script both together. Author connection I'll give you. You can go there, you can listen to it, and you can see how artificial intelligence is not able to catch your pronunciation. Maybe sometimes mine also cannot, because it tries, when you speak correctly, then only it can catch the pronunciation, otherwise it cannot. So you learn how to pronounce them right. Now I give you 1 minute, 60 seconds, absolutely. In the 60 seconds you have to give your feedback regarding what you learned today and how you are going to improve. This is a message not only to you but also to the other students, how they can improve. Yes, come on.
During this speaking section, I got a good feedback regarding my grammatical errors and pronunciations and the importance of the vocabularies. So from today onwards, I decided to reduce or mitigate the mistakes that I had in the speaking section. And I also reduced the word I used, informations, and I promise you I will use the word information, and I did not use the word as well as this. So yeah, I will promise you, sir, I will improve myself after every suggestions that that I got from yourself. Yeah, that's all.
Yeah, fine. From tomorrow onwards, you will have the speaking session like this only. You need not take any other speaking sessions. You have no other practice sessions. You are only testing sessions like now. Okay, you need not take any sessions from anybody now. You will have only one speaking session because you are going for the exam, and the only one. You do very nicely, perform, and show that you are mastering the skill. That's what I ask for you. Yes, and this is Grandmaster class, and I'm Peter Simon with you. This is for the viewers on the YouTube or Facebook or wherever you are. You can just attend our sessions. You can watch from the YouTube, and if you're interested, you can get back to us. And our contact number is +91 98 67360. So you can contact us on this number, and yeah, you can register, you can subscribe for our speaking sessions. Many students don't know that they are speaking sessions. They say speaking section. No, it's a speaking session, right? So you're interested, you can register. There are few seats because the month September is going to come, and so if you want to register, you can join the sessions.